Mosquito season has had a little renaissance with this warm weather. And so public health officials are still worried about mosquito-borne diseases like West Nile virus and now Eastern Equine Encephalitis. And it's important to note, getting West Nile or EEE is very rare in humans. But biologists are still out there trying to learn more and trying to detect the diseases in individual mosquitoes. That's today's story of the day.
Support for Story of the Day comes from the St. Lawrence County Community Development Program, now accepting applications for the Head Start program to prepare children ages 3 to 5 for school. Online at slccdp.org/head-start.
Hey, I'm David Summerstein. It's Tuesday, September 17th. First up, a new initiative seeks to ramp up training for people to work in healthcare in the North Country. Kara Chapman was at the launch at Champlain Valley Physicians Hospital in Plattsburgh yesterday and has the details.
Richard Merchant says there are a bunch of great programs in New York State aimed at drawing workers into healthcare. But there's a problem.
They're just not connected. They're just not working together.
They're all over the state. Hospitals, nonprofits, recruiters.
It would be like if you had an army and the divisions weren't talking to each other and the regiments weren't and the units weren't, and it would just be chaos, which it's been.
Merchant's nonprofit, Health Workforce New York, based in Canton, wants to change that. It's launched the Institute for Career Advancement in Medicine. It's essentially an online platform that hosts and promotes all those healthcare programs in one place. The idea is to engage 6 groups of stakeholders simultaneously: students, career seekers, healthcare workers, training program providers, employers, and workforce development agencies. Merchant says it's free to use. For the students and workers, it provides a bunch of resources, things like internship opportunities, a mentor and advisory team, and information about what's known as wraparound services. Merchant says that last one is important.
Because studies tell us that one of the main reasons that people don't follow a career, whether it's in healthcare or otherwise, doesn't have to do with education. It has to do with funding, transportation, childcare, et cetera, et cetera.
For the trainers and employers, it provides a pipeline to those exploring the healthcare field. North Country Chamber of Commerce President Gary Douglas says that's important for the local economy.
We are great believers at the Chamber that a quality economy is based on a quality community, and a quality community is based on quality health care. So it all interlocks. You want a quality economy, it starts by quality health care.
There's a dire shortage of healthcare professionals around the North Country, everything from doctors and nurses to aides and custodians. The Institute is trying to recruit people like Olivia Bergen. She's a sophomore at Beekmantown High School and one of more than 300 students who pre-enrolled in the Institute before its launch Monday. Bergen says her father was in an accident a few years ago that left him paralyzed from the chest down.
And even before the accident happened, I've always really had a really big passion for neuroscience, and I've always really loved the brain and all the possibilities that come with it and the research that we really just haven't gotten to really see yet.
Bergen says she's now looking to shadow professionals at the hospital in a variety of specialties she's interested in. She says the Institute's platform makes it easy.
You can kind of just click on the area that you're looking for, which was me. It was for like hands-on experience, so a lot of internship opportunities, and I could kind of look through what they had to offer and put in applications for what I was interested in.
Merchant says the North Country really has to focus on growing its own, like Bergen, for a lot of healthcare jobs. And he says the Institute isn't just focused on recruiting nurses and doctors.
But also locally, people can say, I think I want to start in housekeeping, I think I want to start in hospitality and then move my way through, or accounting or administration. So it isn't just for providers, it's for the whole industry of healthcare.
Merchant says there are plans to bring the Institute to other parts of the state, including Western and Central New York. He says it's funded in the North Country through the end of this year, and he expects to hear soon from the primary funder about next year. Kara Chapman, North Country Public Radio, Plattsburgh.
Eastern Equine Encephalitis is a dangerous disease that's already killed several horses in St. Lawrence County and other parts of the North Country. It's transmitted by infected mosquitoes, and while very rare, it can be passed on to humans. A man recently died in New Hampshire from EEE. Public health officials across the region have been telling people to cover up or stay inside when mosquitoes are active. State biologists go out and test mosquitoes for EEE regularly. Across Lake Champlain in Vermont, the state's Agency of Agriculture, Food, and Markets has that job. Vermont Public's Howard Weiss-Tisman joined the team out in the field and has this report.
All right, cover your ears.
Patty Casey is holding what looks like a space-age ray gun for a low-budget science fiction movie. It's about the size of a rifle. She calls it a bugzooka. It's made out of wide-mouth PVC tubing and wood stove hardware, with a motor inside connected to a 12-volt battery, which Casey is carrying on her back like a jetpack. There's a nylon stocking stretched across the end, which catches the mosquitoes as Casey bends over to suck them out of 10 boxes, which are positioned near a swamp at this site in Franklin County.
So you just have to take the nylon out before you turn it off, otherwise they can fly out.
There are about 105 sites like this across the state that also include light traps that draw the bugs in with dry ice and odor, which Casey says smells like a sweating ox. Casey leads a team of 6 technicians who travel around with their own bugzookas, vacuuming up mosquitoes and then bringing them over to the Agency of Ag Lab in Randolph. The bugs are identified in the Ag Lab. They've looked at about 100,000 mosquitoes this summer, and then some of them are sent to the Department of Health Lab or to the Federal Centers for Disease Control, where they're tested for EEE and West Nile virus. The whole process can take up to 10 days.
Our program is really the sensing device or tool that the state has to determine if there is West Nile virus or Eastern Equine Encephalitis in the mosquito population, hopefully before it reaches the mammalian population, so humans and horses are the usual targets of EEE.
It's up to the Vermont Health Department to consider where the virus was found and what the threat is to human health. So far, one man in the state, in Chittenden County, has been hospitalized with EEE, which can cause fever, chills, and fatigue, and in the most extreme cases, cause inflammation of the brain and possibly death. Casey says even with all the time and resources that are put into vacuuming up live mosquitoes and testing thousands of them for disease, she can't really tell you whether it's safe to hang out in your backyard in the evening.
It's sort of the best we can do. I mean, mosquitoes are, notoriously disrespectful of boundaries, and, they have very, very different flight ranges. So, yeah, there's a lot about this program that is very careful, very exact science, and there's a lot of it that we can't answer. We can't be everywhere.
The testing areas are generally set up near bodies of water, with concentrations along Lake Champlain. As of the end of August, EEE has been detected in 66 pools along the Lake Champlain corridor. Casey says most of the time, the public is not really aware of the work she does. She's vacuuming up mosquitoes in some of the most pristine wetlands in the state, but the last month or so has been stressful and busy. The agency added what it calls 16 additional rapid response testing sites near where the virus was detected. And she says everyone involved with the program has been working overtime.
Driving around in Vermont, going to beautiful wetlands, bird areas, seeing wilderness, I love putting my boots on. But this adds a level of stress because when we get into the point where we are concerned for public health, the pressure is on for us to really get it right as we possibly can.
Casey says with the night cooling down, there is less mosquito activity. But EEE is still around, and Casey says she will be out in the field with her bugzooka, vacuuming up mosquitoes right up until the first hard frost, probably sometime in October.
That was Vermont Public's Howard Weiss-Tisman reporting. We have more news all the time on our website, ncpr.org. Music today by Ben Sharon of Watertown and David Archibald of Kingston, Ontario. I'm David Summerstein, North Country Public Radio.